a couple outside there thinking about or wanting to have a baby, it's not too early to start preparing for healthy pregnancy and a healthy baby. This week we are going to learn about preconception care. Preconception care is the care a couple receives before a woman gets pregnant. Therefore, open your ears and hear today. It's very important, if you're there and you're thinking about and you want to have a baby, to start preparing for it. And these are the few important things you need to do under preconception care for you to have a healthy pregnancy and a healthy baby. The first step is make a plan. If you want to have a baby, it's very important for you to sit down and draft a plan. How are you going to achieve this important goal in your life? Very many mothers in Uganda here, if you don't want to have a baby, you take time and plan to have a family planning. But rarely do you plan for a healthy pregnancy. So from now onwards, before wanting to have a baby, sit down and plan for it. The second other thing is see a doctor or nurse for preconception checkups. Here in this visit, you will discuss with your doctor about your healthy or family history. You will talk about your current medical conditions that may affect your baby in future. You will also talk about your lifestyle and behaviors. Are you a person who smokes? Are you a person who drinks alcohol? Are you a person living in a stressful environment or working and staying in a poisonous environment? This is the important time to discuss this with your doctor or nurse so that you can be helped in order not to affect your baby you plan to produce in the future. The other thing is talk about with your doctor the current medications you're taking, because some medications may cause serious birth defects to your child. And this is the important time where your doctor will tell you about the recommended vaccinations that you need to take before pregnancy, which will keep you healthy and keep your baby from getting very sickly or maybe acquiring lifelong disabilities. The other thing is start taking 400 micrograms of folic acid every day. If a woman takes enough folic acid 1 month before or during pregnancy, this is very important because it's going to prevent birth defects to your baby, and these birth defects are about the spine and the brain. The other thing is change your lifestyle. Stop smoking, stop drinking alcohol, and stop taking street drugs. Because you know what? This causes premature births. It may cause birth defects to your child or even infant death. If you're there and you can't stop, please seek for help before you conceive. The other thing is stay away from poisonous environments. Poisonous environment, I mean, stay away from paints, fertilizers, bug sprays, chemical synthetics, cat feces, name it but a few. Stay away from these conditions because they may stop you from conceiving. Or even when you conceive, they may affect your unborn baby. The other thing is you need to start having a balanced diet. A diet full of iodine, iron, folates, proteins, name it but a few. Because this will help you maintain a healthy weight. If you are a mother, you get pregnant when you're underweight. This increases your risk of having a small baby. And if you're obese, this increases your risk to gestation diabetes and heart defects, which will in the end affect the baby you're planning to conceive. So it's better you take care of these conditions as early as possible. The other thing is get help for violence. If you're a woman and you have a husband and you're living in an abusive environment, it's better you work on this one before you conceive, because violence may injure you or even your unborn baby you're planning to have. The other thing is talk about your family history. Are you a mother who have a sister maybe who suffered from sickle cell? or might be a cousin, brother or sister who has a heart defect. You talk about this with your doctor, because this will help you to get enough information and help that will help you not to affect your unborn baby, because genes in our families sometimes affect our babies. The other thing is you need to get mentally healthy. To live to your best, you need to feel good about your life and even value your life. I know sometimes as women, we feel stressed, we are worried about some conditions, we are anxious about some issues. But if this is not controlled and it gets interfering in your life every day, it will affect your unborn baby. So before you conceive, it's better you become mentally healthy, mentally stable, so that you can create a good environment for the development of your baby. The other thing is now have a healthy pregnancy. After doing all that we have talked about, and you get to know that now you're ready to be pregnant, conceive. And after conceiving, please and please keep your new life habits and make sure that you always meet your nurse or doctor for antenatal care, because this one will help you throughout your pregnancy to have a healthy pregnancy and a healthy baby. Thank you.